Good evening. Thank you for joining us here on Facebook Live. My name is Cynthia Ramnerus. I'm a managing editor with the digital communications team at NYU Langone, and I'm very happy to be joined tonight by Dr. Adam Ratner. He is the director of the Division of Pediatric Infectious Disease at Hassenfeld Children's Hospital, which basically means he is our resident COVID-19 expert, COVID-19 in children especially. So he is here tonight to answer your questions, to dispel any myths and to hopefully help you feel more confident about the COVID-19 vaccine in your child. So I'm going to start out, Dr. Ratner. We're gonna hit the ground running here. Actually, okay. I'll let you say hello. Why don't I let you say hello?
Hi.
Okay,
Thanks.
great.
Happy to be here.
Perfect. Thank you. So I have two teenage children, and I feel like there's two groups of people in the world. There are people like me who signed up their kids as fast as possible to get this vaccine, and people who are more hesitant, not quite there yet, some questions. So, and a lot of the hesitancy, I completely understand, has to do with questions about safety. So I was hoping we could just start off with that tonight and talk about how, as a parent, how can I know that this vaccine, which seems like it came real fast, is safe for my child?
Yeah, so that is an important question, and it's a question a lot of people are asking. And just to address the first part of what you said about it coming fast, I mean, I think it's worth pausing for a minute and reflecting on what an incredible time we live in, where when we're threatened by a pandemic like this, we have the ability to develop a vaccine in less than a year and to roll it out. And there, roughly 1.5 billion doses of vaccine have been given worldwide, one of the 3 or 4 licensed vaccines. And that's incredible. And that's what's going to help us beat this pandemic as a planet.
Mhm.
But I do understand people who say, well, it's a little bit scary because this is a vaccine that we didn't have a year and a half ago, and now it's going into so many people and we're moving into children. How do we know that it's safe? So there are a couple of reasons that we know that it's safe. So first of all, while the technology, I'm talking right now about the Pfizer vaccine because that's the only one that we're talking about in children. I'm happy to talk about the other vaccines, but for the 12 to 18-year-olds, the only option
Correct.
right now is the Pfizer vaccine. So while this vaccine is the first of the mRNA type vaccines. It's a new platform, but it's not new technology, and it's technology that's been under development for the past couple of decades. There have been several vaccines developed with it that have gone through early stage testing, but nothing that has gone as far as this one. And the reason that this one was the first one was essentially that it was an emergency, that this was the kind of technology that you could develop a vaccine quickly, roll it out over the course of less than a year and be able to vaccinate large numbers of people. The adult studies of the COVID-19 vaccines, the mRNA vaccines, had incredible data in terms of safety, meaning that aside from mild local reactions and very, very rare allergic reactions, these are very safe vaccines. And so we had data before we even did any of the pediatric trials. We had data from tens of thousands of adults who had received the vaccine. And now, as we're moving into a group of younger children, the 12 to 15 year olds, we have the experience of literally billions of vaccine doses that have been given worldwide. So a good understanding of what side effects look like. And these are safe vaccines, and the trials with kids that have been done so far have not given us any reason to think otherwise. It was important to get the data from children to do trials in kids and understand if the side effects look different. And as far as we can tell at this point, they don't, which is great news.
That is great news. Does the vaccine operate or act differently in a child's body as opposed to an adult? Is that something we should be concerned about?
No, I mean, as far as we can tell, the data that we have gotten from kids in the trials looks very much like the adult data. If anything, kids form a little bit better of an immune response. So,
Hmm.
not so much better that you worry about it, but they respond very well to these vaccines. The rates of the side effects that people have either experienced themselves or have heard about from their friends, adults who've been vaccinated, are
Hmm.
about the same in kids as they are in adults.
Yeah.
And what I'm talking about specifically, when I'm talking about the side effects, is pain in the arm at the site of injection, of course,
Hmm.
because you
Right.
expect that with any vaccine. Some people are really tired for a day or two afterwards. That's what I had. I got vaccinated at the end of December, beginning of January. So as soon as I was eligible, I got vaccinated. And for both of my doses of the vaccine, I had about 24 hours afterwards where I was just tired.
Mhm.
I
Yeah.
fortunately didn't have fever, didn't have anything else like that, but yeah, that
Yeah.
was what I had, and I felt like the protection was well worth that. A smaller number of people will have fevers or headaches or things like that, but they tend to be self-limited, and it tends to last less than a day or two.
Yeah, I'll say my 13-year-old son was vaccinated last week, and on
Congratulations.
Thursday, oh, thank you very much. I was excited for him as well. And Thursday, that was Thursday, Friday, he had a headache. He was sore. He was achy. He was
Yeah,
tired. By Saturday, it was gone.
good.
And yeah, he's very excited to be on this road as I am as well.
Yeah,
But
a lot of my pediatrician friends are who have kids in that age range are
mhm,
very excited to get them vaccinated, and a lot
right,
of my friends who have younger kids are kind of waiting for
right.
the approval range to go down.
Definitely. I mean, I think as parents, you want your child to have the same protection you can have, right? You don't have to worry
Yeah.
about that. So,
My daughter is vaccinated, and I will tell you, I was just as relieved on the day
yeah,
that she got vaccinated, if not more so, than on
I
the
think I
day
was
that
more
I got
so.
vaccinated.
Definitely, definitely, it's a huge relief. But let me ask. I want to go, go back to this issue of questions. You and I, we're really happy. Oh, our kid got vaccinated. But what about the long term? Like nobody. How do we know a year from now we're not going to be like, oh, something happened? Like, what do you say to people who are just worried about the long term consequences or
Right. So the first
effects?
thing I'll say is that I understand that, and I think that it's important for public health folks and doctors and other people to be honest about what we know and what we don't know. And there's no one who can say to you that yes, we have 20 years of experience with this vaccine. Of course we don't. COVID hasn't been
Mhm.
around for 20 years. It's all through this pandemic we have all had to make decisions with less data than we wish that we had. And I look back to early in the pandemic and what we were doing to treat kids with severe COVID then, and that we're better at it now. Not surprising, and I wish I could go back and tell myself then what I know now.
Yeah.
Um, but that said, with vaccines, we have a lot of experience vaccinating kids. Kids get more vaccines than adults
Right.
do. We know how
Hmm.
kids react to vaccines. When there are side effects of vaccines, they tend to be things that happen in the hours or days or maybe weeks after vaccination. I'm not familiar with side effects that come up, months later, years
Hmm.
later, things like that. There's no reason to think that it would be different with this class of vaccines. So the mRNA vaccines, when they are injected, the mRNA does what it does. It helps your cells make the spike protein, then you make
Hmm.
antibodies against that. But the mRNA is gone quickly. mRNAs are not stable things. They are certainly within a day or two. They are gone and out of the body, and your body is making the immune response like it would to getting COVID. But the good thing
Hmm.
about it is you don't have to get COVID to get that immune response.
That's wonderful. Yeah, that's a benefit. Um, you know, Another, talking about development and as time goes by, another concern I've heard a lot about is 12 to 15. We're talking about kids in puberty. We're talking about kids who are going through massive growth spurts,
Sure.
massive changes hormonally, and now we're injecting them with a vaccine. Um, any concerns there about that? Can it affect pubertal development? Can it affect growth? Can it change anything there?
So the short answer is no. I mean, we vaccinate kids in that age range already against lots of stuff. Again,
Mhm.
kids get flu vaccines, or they should be getting flu vaccines every year.
Sure.
The HPV vaccine is given in that age group. The meningococcal vaccine, which is something that everybody gets before college, certainly some kids get it younger, is in that age group. And for I guess we saw this with the HPV vaccine, where there were rumors when it came out that it was going to affect pubertal development, that it was going to affect fertility, but those were not grounded in any kind of science or any kind of understanding of how the
Mhm.
vaccine worked. And the same thing is true with the COVID vaccine. There are absolutely those kinds of rumors out there, but there's no reason and no data from the billions of doses that have been given, no data that they affect hormone levels in any way, that they affect fertility in any way. Lots of pregnant women have been vaccinated with the COVID-19 vaccines. It has proved to be very safe in that group also. I mean, I think that when you're deciding about vaccinating versus not vaccinating a kid in that age range, you're a lot of people think, well, doing nothing is the safe thing. I would argue that not vaccinating a child in the setting of a pandemic, that while it's on the way down in the US, it's certainly
Mhm.
not gone. We have plenty of COVID in New York City. I would argue that that's the more dangerous choice.
And that leads to my next question, which is, what we hear, COVID, kids get COVID, but from what I hear, it's not that bad. They don't get it as bad as adults. Is this something we really need to vaccinate kids against?
So there are a couple of reasons that the answer to that is yes. So the first is that while it's true that if you look at the population of kids who get COVID and the population of adults who get COVID, the adults are generally sicker than the kids. Absolutely no question about it. If you have to have COVID, you're better off being a 16-year-old than being an 80-year-old, without a doubt. But there are plenty of kids who have had severe COVID. I have taken care of lots of them in our hospital, in our intensive care unit. It's rare, but it happens. And kids get COVID pneumonia. Some of them need to be on ventilators, and there have been several hundred. The estimate is around 500 pediatric deaths in the United States over the course of the pandemic, which is horrible.
Right.
Um, and even just that alone puts COVID in the top 10 causes of death for children over the last year.
Mhm.
Now, of course, fortunately, mercifully, children don't die often, like the rates of childhood death are low, but it's still like it exceeds what you see for in a typical year for influenza, and
Mhm.
it's an important cause of severe disease and of death in children.
Mhm.
And then the other piece of this, which I think gets overlooked, is that even in kids who have mild COVID, they can have symptoms that go on for a long time. So we everyone's heard about long COVID or long haul COVID, which
Right.
is something you see mostly in adults, but kids can get that too. And there are kids who have mild symptoms or no symptoms at all, but then
Mhm.
can go on to have fatigue, headaches, respiratory symptoms that can go on for months or longer.
Mhm.
And then the other piece of that is that there's a subset of children, and it's small, but it's significant, who get this thing called MIS-C, this multi-system
Mhm.
inflammatory disease in children, which is something that happens after COVID-19 infection. Often it's after a very mild case of COVID-19,
Mhm.
and that can be life-threatening. There have been about 4,000 cases of that in the U.S. Over the last year,
Right.
and somewhere in the neighborhood of 30 to 50 deaths from that. So it's
Yeah.
not a benign disease in
Mhm.
children. It is something that is worth vaccinating against. And then this is the last thing about that I'll say, is that the other reason to vaccinate kids and the other reason to vaccinate low risk people in general, because kids really are still low risk, is to help protect the rest of us. And one of the ways that we get as close as we can to herd immunity is by vaccinating the herd, and kids are part of our herd.
Right.
Kids are less contagious in general than adults because you're more contagious if you're more sick, but they still contribute to the spread of
Mhm.
COVID in the community. And
Right.
vaccinating kids protects them against acute COVID, protects them against long term symptoms of COVID, and protects the population as a whole.
Right, right. Well, what if I'm a parent who, let's say my child has allergies, allergies to food allergies, environmental allergies. You hear about the precautions on this vaccine, and one of them is, possible allergic reactions. If my child has an allergy, should he or she be vaccinated?
So almost certainly yes. The exception to that is, there's stuff in the vaccine, like there's stuff in any medicine, and there's a list of ingredients that's in the package insert or on the CDC
Mhm.
website. And if your child has severe allergies against, propylene glycol polyethylene glycol is the major thing that if people have allergies against it, they shouldn't get the mRNA
Mhm.
vaccines. They should get one of the other vaccines. But the list of ingredients is actually pretty short. And if your child has like severe allergies, not seasonal allergies, but like medication allergies and stuff, you can show that list to your pediatrician or your allergist, and they can help make that decision. But
Okay, good to know.
these are not typical things for people to be allergic to.
Okay,
So it's possible, but it's a rare reason that someone wouldn't be
right.
able to get vaccinated.
Well, I have to throw out there, you mentioned, you had a lot of big words there, polyethylene. How would I even know if I were, if my child was allergic to that? Is that something that's found elsewhere that we would know about, or?
It's in some other medications. It's
Okay.
it's something where I what we're talking about is if someone has had a life-threatening reaction to another medication, like
Okay.
a true anaphylactic type reaction,
Hmm.
then that's someone where, sure, run the list of ingredients by your child's allergist, absolutely.
Hmm.
But the rates of allergic reactions that we've seen with vaccination against COVID have been extremely low.
Hmm.
And I
Hmm.
mean that's why they do the watching people for 15 minutes
Hmm.
afterwards, just to make
Right, right,
sure.
right.
And it's the rate of severe allergic reactions is really low.
Really rare, very rare. Okay, great, great. Well, now I wanted to talk with you about of other vaccines that children need
Sure.
in childhood. Like you mentioned earlier, vaccines are a children's game. They got a lot of them. My 16-year-old daughter, she had gotten her meningococcal vaccine
Great.
about 2 weeks before, before the 16-year-olds became eligible. And I was hesitant because I'm like, oh, she just got this other vaccine. Is that some? Do we need to worry about spacing these out? Is it too much vaccine at once? What's going on
So
there?
this was a point of discussion because when the mRNA vaccines first came out, the advice from CDC and FDA was don't give another vaccine for 2 weeks before and for 2 weeks after.
Right.
And actually, it may have even been long. It may have been 4 weeks before and 4 weeks after when it initially started. That was the main reason for that. Wasn't that anyone thought that it would stop either of the vaccines from working well or that it would cause a reaction or anything like that. The idea was if we didn't know how common reactions to the COVID vaccines would be, and they wanted it to not be confusing. They wanted, like, if you had a reaction to the COVID vaccine, they wanted to know that that's what it was due to. Now, with 1.5 billion doses given, we know how rare those reactions are. And
Okay.
CDC and the American Academy of Pediatrics, when they announced the approval down to age 12 for the Pfizer vaccine, they also said, oh, and it's okay to give this with other indicated vaccines. So
Okay.
I wouldn't hesitate if you have a kid who needs a flu shot and the COVID vaccine, they can get those at the same
Wow.
time. I mean, it's
Okay,
not
that's great.
flu shot's not out yet, but like if
Right.
someone needed the meningococcal vaccine or one of their HPV vaccine doses, you're good.
Okay, and the immune system can handle all that. It's
Definitely.
all. It's all
Yeah,
good. It's
it's
all good.
your
Okay.
immune system is really good at handling things, and it's there was this sort of anti-vaccine rumor going around for a long time that, oh, we're overloading children's immune
Mhm.
systems. Children are exposed to tremendous numbers of bacteria and viruses all the time. The vaccines that they get, the COVID vaccines are a vaccine that targets exactly one protein, as opposed to,
Mm.
when you're exposed to a viral infection or a bacterial infection, you're exposed to tons of different antigens. And so it's there's not immune system overload from this.
Okay, good to know. Good to know. They're mighty. They're mighty, these kids.
Yes.
Um, what if I'm as a parent, I want my child vaccinated and my teenager is like, nope, I don't like needles. I'm afraid what I've read. What as a parent can I be saying to my child that will be on their level and help convince them?
Yeah, I mean, I think that's a discussion that you have to have. The first thing that I would do in that situation is try to get at where that no is coming from.
Mm-hmm.
Is that a no because of not wanting needles, which is one thing? Is it a no because of the misconception that COVID's not dangerous in
Mm-hmm.
kids? Because that's a different discussion. And I would, I would probe that and try to understand why. I mean, one thing I think I would point out to a teenager who is hesitant about this is that things are opening up, which is great,
Mm-hmm.
and that being vaccinated is going to provide access to things that you may not have access to without being vaccinated, being able to not mask in places where you would otherwise have to mask. And what happens specifically in terms of school in the coming months and year isn't totally clear yet, but it may be that some schools decide that if they have classes that are all vaccinated, that they'll be able to relax some of the masking restrictions and the distancing restrictions, because even though the governor of New York today announced that they're backing off on mask restrictions and going by CDC guidance. That doesn't include schools,
Mm-hmm.
because most children are not vaccinated yet.
Mm-hmm.
And
Mm-hmm.
we know that one of the things we've learned over the course of the pandemic is that we can do school safely, but doing school safely means masking and distancing and everything else. And
Right, right.
so I think what gets us back to normal school, not masked, not distanced, is vaccinated grown-ups in the school, of course, vaccinated
Of course.
teachers and
Yep.
staff, but also vaccinated kids.
Mm-hmm. Wow, you're creating an image for me of a post-COVID vaccinated future here.
I'm hopeful. Yeah, it's
We all are.
yeah.
Yeah, yeah. So so the vaccine itself, I mean, what if, let's say I'm not there yet, don't want to get my kid vaccinated yet. Is masking still enough? Like, especially with the COVID rates coming down, and they're coming down a lot in New York. So is masking enough to protect my child?
Yeah, I mean, I think that the short answer is yes. Like, masking and distancing is good protection against
Mhm.
COVID. The best protection I think that we can offer right now is being vaccinated. I certainly, before the vaccines were available to anyone, I
Mhm.
still came to work. I rode the subway and stuff like that, but I
Right.
was much more nervous than I am now. I mean, I still mask on the subway, um, but I think that we, I certainly breathed a big sigh of
Mhm.
relief once I was vaccinated, and I think that that's available
Mhm.
to people and their kids as
Mhm.
well.
Well,
But
yeah.
yeah, I mean, and certainly if there's a kid who's not going to get vaccinated yet, either because they're not eligible, or
Mhm.
the parents are still thinking about it, then that kid still needs to mask and distance and all
Mhm.
the other stuff, because
Well,
there's still
right.
plenty of COVID out there.
And there's still plenty of under 12-year-olds who can't even be
Absolutely.
who can't be vaccinated yet.
Yep.
So, I mean, masking is going to be part of our lives for at least the next few months. So it's good to hear that masking does provide protection for
Yeah,
those kids too. But it
absolutely.
seems, um, the more that we can, like you said, move toward that herd immunity, the more we're protecting even those who can't be vaccinated yet.
Yeah.
Absolutely. Okay. So what about the return to school is in September? Well, I mean, we're still in the school year here, but
Yeah.
what about a parent who says, well, you know what, let me wait. Let me just wait until September and then I'll get this done. Why should they do it now as opposed to waiting for the new school year?
I mean, I'll say what I usually say about parents who are vaccine hesitant for younger kids and want to wait a while. The problem with that approach is just that the waiting period isn't necessarily safe. And I
Mm,
think that the best protection that we can provide is available now, not again, not to all kids, to kids 12
mhm,
and older. Um, and I think it's worth getting your kid protected as soon as possible. The other
mhm,
thing is it takes a little bit of time. There are 3 weeks
mm.
between the doses, 2 weeks after the second dose until you reach peak protection.
Right, right.
And so that's, yeah,
Mhm.
it
Can
takes
you
a little while to ramp up.
Right. Can you talk a little bit about why we need two doses for this, especially with kids? It seems maybe why not just one?
So you get actually pretty reasonable protection after one. So that's it's been looked at for the mRNA vaccines, but you do better after two doses, and
Hmm.
meaning
Hmm.
that the titers of antibodies are higher, they last longer, and just the overall protection is better. And so
Okay.
what we know about duration of protection and the great numbers that we've seen, the 95% protection, that's all after two doses.
Right, right, right. So what happens between the first dose and the second dose to make it better?
So the first dose, your cells make some of the spike protein. Your B cells and your T cells, like your immune system, goes there and they
Hmm.
sense this foreign protein and they start doing what they do. They start making antibodies to it and T cell responses to it. But often your immune system gets better at things the second time around, the time that you're challenged, and so you give your immune system time to rev up that first time, and then you show it the same protein again, and then you get these B cells that make tons of antibody and they make better antibody. And so
Right.
it's the same reason that for a lot of the childhood vaccinations, the polio vaccine, the measles vaccine, stuff like that, there are multiple doses.
Oh, that's right. That's a good point. Some have like up to five, I think, doses, right, over the
Yeah.
course of
So
childhood. Okay. Do we know yet? Do you envision that this will be something we'll be doing every year or on a booster basis?
so we've nobody has more than a year, maybe a year and a half of
Right.
experience with this virus or these
Mm-hmm.
vaccines. So I don't know the answer to that. What we know so far is that the antibody responses seem to be really robust and to last as long
Mm-hmm.
as we've looked at them so far. I
Mm-hmm.
don't know the answer to that. I wouldn't be
Okay.
surprised if
Mm-hmm.
people needed a booster, either because their variants came out that
Mm-hmm.
the vaccines had more trouble with, although the vaccines have been good at covering the variants so far,
Oh, that's good to know.
or because if over time the antibody levels waned and if
Mm-hmm.
there's still COVID around in the world, it would
Mm-hmm.
then be worth getting a booster shot. It seems like a small price to pay. I would be happy to get a booster every year if I needed to.
Got it.
I don't know if it'll be every year. Could be.
Okay.
Yeah,
We'll
it's
see.
we will see.
Do you have any insight on when a vaccine will be available for younger than 12?
So I hope that the data for down to about age 5 is expected by late summer. Assuming everything goes well, assuming there's
Mm-hmm.
not a safety issue or anything else, because it's important to watch for that. I would hope by early fall they would be available, but I'm not totally sure. It depends on how the trials go, and
Mm-hmm.
hopefully there won't be surprises in there. But it's why they have to do the studies.
Okay, okay. So, but we're on the road. We're on the
Yeah,
road to getting to
absolutely.
moving them along. Okay. What if? What about children who are exposed to COVID after they've been vaccinated? Do we still need to quarantine? Do we still need to get tested? What's the ruling
So
there?
if you're more than 2 weeks out, if you're fully vaccinated, you're more than 2 weeks out,
Mm-hmm.
and you have an exposure and no symptoms, then no is the short answer to that. Like
Okay.
you don't have to do that. If you are exposed and then you develop symptoms,
Mm-hmm.
as we've seen from the Yankees, like it's possible to get
Mm-hmm.
COVID after being vaccinated. It's just that it tends to be much milder than in an
Mm-hmm.
unvaccinated person.
Right.
So if someone who is vaccinated and has been exposed has symptoms, it's worth getting tested at that point,
Okay.
just because that's someone where I would say, yeah, probably don't go into an environment like an unmasked school kind of situation.
Okay.
You don't want to transmit to either someone who's unvaccinated or maybe someone who's higher risk who's there.
Good point. Good point. Okay, well, final question here. As someone who you've been on the front line of this since the very beginning, just tell me what it means to you as a pediatrician, as an infectious disease specialist, to have this vaccine for this age group.
So I was watching the ACIP meeting on my computer, the CDC meeting where they were voting on on whether this would be approved for the 12 to 16 age group, and I cried when it was approved, because this is a group that is vulnerable, and it's it is great that we had a vaccine down to age 18, but I think this is, as we extend into other populations and as we get it more available, this is the key to ending the pandemic. Like, this is what gets us back to normal life. So it means a lot to me.
Thank you. I yes, that's such a strong message for us to say thank you very much, Dr. Ratner. This has been fantastic. I've learned a lot. I hope it's been helpful to those of you out there. Thank you for watching. If you're interested in a COVID-19 vaccine for your child, vaccination is available to all NYU Langone patients through the MyChart app. So please check that out. Otherwise, all children, all people ages 12 and up can go to public vaccine clinics now. So please consider that. And thank you very much. And also please go to the Hassonville Children's Hospital webpage and our Facebook page and hit that like button so you can find out about our future events. So thank you very much again, Dr. Ratner. And
my pleasure.
It's been a great night. Thank you.
Thanks.